Hello everyone and welcome to this new lecture. In this lecture we will be discussing something very important, that is the intracanal medicament. What are the intracanal medicament and what are they used for? First of all, I will mention some important consideration regarding intracanal medicaments. When we do tooth root canal instrumentation, we have to wait sometimes, and this takes 2 visits to complete the intracanal treatment. Therefore, during this time, we have to use intracanal medicaments. What are the functions of intracanal medicaments? First of all, they disinfect the root canal system, inactivate endotoxins, and preventing reinfection. Reduce pulp inflammation response and reduce pain. They are useful in case of inflammation due to over-instrumentation. They help alleviate or help eliminate periapical exudate. They help eliminate apical exudate. They help degrade residual organic material, including the pulpal tissue, and induce hard tissue formation. Next, let's talk about the properties of an adequate intracanal medicament. What is the optimal properties for intracanal medicament material? They have to be effective germicide and fungicide, non-irritant to pulp tissue, and do not interfere with repair of pulp tissue. They remain stable in solution. They have a prolonged antimicrobial action and remain active in presence of pus or blood. They have low surface tension. Low surface tension is, of course, a necessity. Not staining the tooth and do not induce immune response. Let's talk about some of these intracanal medicaments. First, let's begin with eugenol. That is an essential oil clove that has antibacterial properties and analgesic properties. It's a constituent of most root canal sealers and temporary filling materials. That's the eugenol or zinc oxide eugenol as a temporary filling material. Their limitation is in high concentration that they have cytotoxic property, and they have an adverse reaction, or they cause adverse effects like allergy and irritation when they are in contact with dermatitis or dermatitis. And they may impair the setting reaction of the resin-based material like light cured composites or light cured GIC material. Next is the phenolic material as another medicament. Phenolic is a bit easier because it has antimicrobial property, but it has a very cytotoxic and could induce inflammatory response in tissue. It was chemically modified by adding camphor, resulting in a prolonged antimicrobial action and less toxicity to the pulp. It slows the release of toxins in this case. An example of phenol is camphorated monochlorophenol, CMCP. Next material we'll talk about is aldehyde. So aldehyde have an advantage of being a very soluble substance that have the ability to denature cell protein, and they are considered among the most potent disinfectants. They also are used as dressing or for pulpotomy treatment or primary teeth, or in case of emergency treatment of acute pulpitis to fix the pulpal tissue. In case of acute pulpitis. An example of aldehydes include formaldehydes, tricrysol formaldehyde, tricrysol formalin. Tricrysol formalin is 10% tricrysol, 90% formaldehyde. And it acts by direct contact and vapor action with a bactericidal action. Limitation of formaldehyde or triclosorformaldehyde is classified as highly irritant, and formaldehyde causes adverse reaction when reaching apical tissue and possesses a very harmful effect with contacting living cells. The use of formocrysol and tricrysol now has declined because of the potential adverse effect, potential carcinogenic effect too. All phenolic components and aldehydes, by the way, are highly volatile with low surface tension. If they are placed on a cotton pellet in the pulp chamber, vapor will penetrate the canal, the entire canal preparation. Only a tiny quantity of medication is needed for effectiveness. Otherwise, chances of periapical irritation increase. Next, we'll talk about halogens. What are halogens? Include, of course, chlorine and iodine, which are potent oxidizing agents with a rapid bactericidal effect. Again, potent oxidizing agent and with rapid bactericidal effect. Iodine, potassium iodide, and its advantages that it has a strong antimicrobial effect. It has a vapor action, has low tissue toxicity. Again, strong antimicrobe, vaporizing, and low tissue toxicity. That's all about the halogens, including iodine and chlorine. Limitation, potential for allergic response. Again, potential for allergic response and cause staining. Staining is not good, of course, when it comes to aesthetic. Next, let's talk about antibiotics and recurrent medicaments. Since the endodontic infection is polymicrobial in nature and there is no single antimicrobe that is sufficient There is a lot of microbodies and bacteria in the root canal system. Therefore, we have to use different types of antimicrobes or antibiotics. A combination of ciprofloxacin, metronidazole, and monocycline can be considered. There is a risk of side effects of antibiotics, including allergy, bacterial resistance, favorable conditions, or fungal growth. And minocycline can cause tooth discoloration if it's used intracanal. Okay, this was all about the antibiotics. Now we'll talk about the corticosteroid plus antibiotics. The advantages are that they are effective in reducing inflammation and pain. And after an inflammation procedure, antibiotics are added to prevent growth of bacteria until inflammation subsided. They produce antibiotic and prevent growth. They cause instant relief of pain in the patient who complain of extreme tenderness on percussion after root canal treatment. They must be placed in the inflamed periapical tissue by a paper point to be effective. This is one thing. Let me drink some water first. Anyways, I was saying that they have to be placed by a paper point to be effective. Example of these are leader mix paste, which is a non-setting water-soluble paste material. And it is a combination of corticosteroid and antibiotic. Antibiotic including tricycline, corticosteroid is a triacinolone, acetonide, triamcinolone, acetonide. This is a leader mix. If a question came to you, what is a leader mix? You'd have to say that it's a corticosteroid plus antibiotic. And its limitation, of course, in discoloration, because tetracycline causes discoloration in the tooth. As usual, we know that. And the possible depressive effect of steroids on the host defense mechanism. Now moving to chlorhexidine. That's an important one, of course. And its advantages is that it possesses a wide range of antimicrobial activity, substantivity, and lower cytotoxicity. It is also recommended in cases of exudation. It has lower cytotoxicity in the root canal, and recommended in case of exudation, periapical or apical exudation. as it retains its antimicrobial activity in the presence of blood and other organic materials. It retains its antimicrobial activity in case or in the presence of blood and other materials. That's an advantageous property. Chloroxidine gel is delivered into the canal with a syringe, and it's easily introduced and removed from the both canal systems. That's why it's easy to be used. Unlike the calcium hydroxide that we will discuss later on in this video, it also has limitations, and I will discuss these limitations soon. It's recommended for a short period of time, only 3 to 5 days after complete instrumentation of root canal sites. We know that chloroxidine must be used in a short period, even if it was used in a mouth-rinsing situations. About a week is enough. Recently, chloroxidine available as a good aperture points, active points for temporary root canal filling, and for emergency root canal treatment. Active point consists of chloroxidine diacetate, 5% aperture, zinc oxide BASO4, and color agents. Normally, active point remains in canal for 1 to 3 weeks. Again, in this case, when we use chloroxidine as get aperture point, and these points, not a paper point, it's called get aperture point. They are active point components or consisting of chloroxidine and of course get aperture, zinc oxide eugenol, BASO4, and coloring agents. Owing to the greater activity against gram-positive than gram-negative bacteria, application of chloroxidine as intraoral medicament, and it's prepared in a treatment case compared with initial endodontic infections. Again, it's preferred in retreatment as compared with initial endodontic infection. So when do we use in? Some people ask me from all around the world that when do we have to use these paper points containing get aperture, BASO4, chloroxidine coloring agents, and zinc oxide. I will tell them precisely that in retreatment rather than first treatment. Moving on to the calcium hydroxide, and let's talk about its advantages first, and we then go to its limitation. Its advantages are that it has antimicrobial activity, which is bacterial cells in a limited area, and induction of hard tissue formation. This is one of the most property of calcium hydroxide, that it induces hard tissue formation. Next, it's stable for long periods of time. And of course, it's harmless to the body, like zinc oxide eugenol that was harmless to the body. Calcium hydroxide paste is considered a very strong base with pH of 12.5. That's a very high pH, by the way, and it's a basic pH. Limitation. Several studies have reported that calcium hydroxide is not effective against Enterococcus facialis, which frequently isolated from teeth after failure of root canal treatment. And that's a problem because calcium hydroxide is not very effective against all kinds of bacteria. The handling and proper placement of calcium hydroxide paste en route can present a challenge and its removal is very difficult. Unlike the chlorhexidine, that was very easy. The removal of calcium phosphate, calcium hydroxide is most frequently incomplete, and residual will remain on the wall surface of the root canal cavity, even after copious irrigation with saline and other detergents or materials, disinfectants. The residual of calcium hydroxide also poses a problem as it can shorten the sitting time of zinc oxide engineer and basic vertex sealers. Residual calcium hydroxide in a canal is also concerned that it is not total, effective against several endogenic pathogens, as we discussed before, including Enterococcus facialis and Candida species, leading to a various infection. Indications for calcium hydroxide. There are some indications, including epixogenesis, are used with calcium hydroxide. When we see a weeping canal and we see a resorbed canal, a resorption case, we use calcium hydroxide. And it's available in paste, single paste of combination of iodoform and powder form. Needs a mixture with water or a slurry or calcium hydroxide water and dissolving, etc. The placement and removal of medicament from the canal is time-consuming and difficult procedure. Of course, it's hard to place it, as we discussed before, and there will be some development in some material of paper bonds and gutta-percha that benefits from calcium hydroxide, that it's impregnated with calcium hydroxide and chlorhexidine, which could be placed and removed easily from the broadcast. Last subject is that we will talk about today is about sealing. What is sealing and how should we do it with root canal treatments? Because endodontic treatment usually takes 2 or more appointments. Temporary sealing agent needs to close the excess cavity between visits. Fortunately, zinc oxide powder with eugenol provides an excellent seal and is easy to place and remove. Zinc oxide eugenol, of course, I'm talking about today. However, it might interfere with the setting reaction of the resin-based material, and that we should know, as it might interfere with the setting reaction of the resin-based material. That zinc oxide eugenol could delay these polymerization reactions. Thank you for listening to this lecture. It was an amazing lecture. We have enjoyed and get a lot of information. Consider it as a reading of a book that you don't have to read. Consider it as an audiobook with explanation. Consider it and take it with a great grain of salt.